We are continuing on in the growth and development chapter. I'm on page 663 in your anatomy book. And we've gotten to the point now that baby's born. So we're going to talk about what happens following the birth and growth and aging to our body. So we call it postnatal as soon as you're born, and it's considered postnatal. I mean, we are all in our afterbirth period, no matter what age you are. And so we have a great chart here of the development of the baby. Look, if you look at proportion size, that newborn baby's head is huge proportionally to the rest of their body. You can see it's like a third of the size of the body is their head. That continues to become a lesser percentage as you grow into adulthood. So infancy, we call the person an infant from, I love how they say this, it begins abruptly at birth. It's like baby didn't want to come out. Baby was perfectly happy inside there, warm, taken care of, and then all of a sudden we thrust them out into the world. There's light, they're cold, they don't know what just happened, okay? So it begins abruptly at birth, and we call them an infant till about 18 months. The very first 4 weeks are a special period we call the neonatal period. You will see that when we start coding for these newborn babies, those first 4 weeks are coded special as well compared to after the 4 weeks. So we could have two babies with the exact same thing wrong with them. One is 3 weeks old and one is 6 weeks old, and you will not code them the same. Those first 4 weeks have special codes just for the newborn. The condition of neonatology is the study of new birth, and we call the baby themselves the neonate. Remember, all of those are the 4 weeks, first 4 weeks. And then we call them an infant till about 18 months. Now, most of us don't call them an infant that long. Most of us start calling them a toddler once they start walking, but the reality is healthcare calls them an infant still. Babies are going to start with this beautiful curve in their body. Eventually, they'll learn to hold their head up, so they'll build this curve. They'll learn to sit, and actually this curves back, and you turn into this. Curves, that's the way it's supposed to work. All of those things are happening at the different phases. As baby is learning to hold their head up, they're developing that cervical curve that they need. We also learn to control our body from brain down. So one of the first things they're going to learn to do is to hold their head up. And then they're going to learn control of their hands. Then they will learn how to sit, keeping their spine upright when you let them go. And they'll learn that muscle tone in the spine. They'll learn how to sit. And then the last thing they learn how to do is how to walk, because we got to get all the way down to the feet. Childhood, we call them a child from the end of infancy. So we call them a child starting about the 18-month mark until they hit puberty. 12 to 14-year-olds in girls, 14 to 16 typically in a boy, although every child is different. And, of course, much sooner than that, we lose their teeth. The deciduous teeth are their baby teeth. Around 6 months, they start showing up. And then their permanent teeth, age 6-ish, except for those final molars, which kind of come out. I think you have 12-year-old molars, 14-year-old molars, and typically the wisdom teeth, we call them the 16-year-old molars. So if you think about our evolutionary history, where dental care didn't exist, like in caveman days, or certainly wasn't as advanced as it is today, if we're talking 100, 200 years ago. By the time we hit 12, 14 years old, it was very likely many of these teeth were rotted. So we needed some nice fresh teeth as we're entering our young adulthood. And that's where all those molars came in really handy if other teeth had been rotting and or maybe even pulled out by that point because they were so bad. So these fresh, beautiful molars in our teenage years were very welcome. Nowadays, because of good health care and good dental care, most of us don't need our wisdom teeth. That when they come in, there's no room for them because we didn't lose any teeth. Some children, of course, have some teeth pulled in order to make some room when they get their braces on. And sometimes they can have their wisdom teeth come in and there is room for them because we made room during the orthodontic procedure. Other people, their wisdom teeth never come in. They just kind of hang out below. If they're problematic, get them taken out. One of my daughters, she's 25 and she's getting them out this year. She wants to get in and get those taken care of. They're giving her problems. Adolescence is their puberty time. Okay, so it's from whatever time puberty starts till their adulthood. How do we know that they've hit puberty? So what are the signs of that? We talked about the hormones that turn the little girl into the young lady, the little boy into the young man. Obviously, in a female, a big sign of that is that they begin to menstruate. But also we have the breast development, hair development on legs, genitals, and armpits. All of those are signs of that. For the little boy, the testicles actually will enlarge during that time. Again, hair growth, genitals, legs, armpits, face, maybe even chest at different rates for all of those. A little more muscular development, and then, of course, sometimes their voice will deepen. I did not notice when my son's voice deepened until I talked to him on the phone. Talking to him face to face, I wasn't really noticing. I talked to him on the phone one day and went, whoa, that's quite a different voice than it used to be. So it just kind of snuck up on me. And then adulthood. Okay? So all of us attending Ross, we're somewhere in the range of adulthood at different places. And then we continue to grow. One of the things, as we reach our adulthood, we're in peak physical condition, we're the healthiest we're going to be, and then at some point we start degenerating. And that process is different for all of us. Injuries can certainly accelerate that. If you've had some sports injuries and you've got a bad knee or a bad shoulder, the degeneration is going to go a little bit faster. Part of that also has to do with what are we putting our body through on a daily basis. By that I mean, what nutrition are we giving our body? Are we giving it junk food or good food? Are we giving our body alcohol regularly? That's a problem. Are we carrying an extreme amount of excess weight? Excess weight puts all that weight on your ankles, your knees, and your low back with every step that you take. And so all of these things can accelerate the aging process, and you could be feeling very old in your 40s or very good and young in your 40s. It depends on what you've done to your body. And then, of course, we continue to degenerate. We are going to continue to age, and at some point we all die. As we become the older adult, lots of things are decreasing in the function of our body. So this is a pretty good a picture. Our cardiac output is about 65% what it used to be. Respiratory about 55%. Our kidney function goes down. Our liver function goes down. Our basal metabolic rate, which is your metabolism, goes down. And your brain actually shrinks a little bit. Not much, but we all know cognitive function goes down. If you think of your parents or your grandparents, dementia, things like that, that all come with those aging parents that we're all either have or will have. The rest of the chapter goes through the effects of aging. The skin becomes drier and thinner. When we learned about the integumentary system, we talked about the sebum, which is nature's skin cream. It gives us elasticity and moisture in our skin, and that goes down as we age. I know I'm in my 40s, and I know that I use a lot more chapstick than I used to, and I'm putting on a lot more hand lotion than I used to. I have always hated hand lotion, and in the last 5 years, it's become one of my best friends because my hands are always so dry, and that's the aging of my skin and the process that's happening. The skeletal system, of course, will our strength of our bones goes down. Osteoarthritis, osteoporosis, different diseases there. The central nervous system, I already mentioned dementia, but even if you still have a really sharp brain, your thought process slows down. So when we talk about communicating with elderly patients, one of the tips we talk about is talking slower. You don't need to talk louder. They can hear you just fine, some of them. But talking slower, you give them time for their brain to process what you're saying because they can't think as fast as they did when they were in their 20s. It's just absolutely the way we age. Special senses, eyes, ears, taste buds, everything. We start losing some of them. We have the term called presbyopia, which means old eyes or old vision. I think of that as the person who needs reading glasses in their 40s. These are reading glasses. I actually have contacts in as well that I need for far vision. But my reading and my far vision, I need different prescriptions. So we've made my eyes the far vision, and I wear reading glasses when I need to. It started as hit and miss. Sometimes I needed them, sometimes I didn't, depending on the day. I need them 100% of the time now to read, especially if I'm reading a coding book. That can't just at all. Another thing that comes with age is cataracts. Cataracts is an ongoing exposure to UV light, sun, tanning beds, etc. And it takes a while for it to affect you to actually need it. So you're not going to see a young person with cataracts because it's an aging type disease. Glaucoma is also an aging disease. It's an increased pressure inside the eye. We also lose our taste buds. This is the sad part. 40% of your taste buds exist once you get to the age of 75. That's sad because, like, I love food, and the thought of losing my enjoyment from food is really sad. But that's why a lot of your old people don't want to eat. My dad, at the end, he didn't care about eating because he couldn't taste it. You had to force him to eat because he needed nutrition. He didn't want to drink. He was dehydrated all the time because he couldn't taste it. He didn't care anymore about food. And I know my grandmother struggled with weight her whole life, but most of my memories are her of over age 60, and I don't remember her overweight at all. I look at these pictures of her younger and go, that can't be her, because the her I remember past those ages, and she barely ate in her late life, and she was this little old lady. But she wasn't through most of her life. I do kind of look forward to being thin. That's something I got to look forward to, right? Okay, cardiovascular, we have a buildup of fat inside our blood cells called atherosclerosis. Arteriosclerosis is hardening of the cells, hypertension. These aren't things that show up overnight. The atherosclerosis, which leads to blockage of your coronary arteries, you need bypass surgery, you might have a heart attack. That doesn't happen overnight. That happens of 40 years of feeding your body the wrong food. The McDiet, the pizzas, the chips, the sweets. Yeah, your body can handle it when you're 20, 30, 40, 50, sure. But what's going to happen as it accumulates over 30 and 40 years of eating like that is heart attacks, heart blockages, etc. And you're not going to know it until you get to be 50 and 60, what you've done to your body. And you can't undo it at that point by just cleaning up your diet. It's also very hard to clean up your diet at that point after 50 years of eating that way. Respiratory system, your breathing is lessened, which means your energy is lessened. Urinary problems, of course, reproduction. Women hit menopause and the ability to reproduce ends at some point. It says here between the ages of 45 and 60. Whoa, I can't even imagine someone, closer to 60 still getting pregnant, but clearly the numbers show that it can happen. And that's your chapter. Okay. Good luck with this.